Hello everyone, I am here with Dr. Carey Bayer, and you have quite a pedigree of things you do in sexuality, so can you tell our viewers a little bit about what you do?
Sure. So I knew have known since the mid-1990s that sexuality was going to be a part of my professional career. Started from taking care of an adolescent who had delivered a baby, and she was about 11 or 12.
That's young.
Had a hard time taking care of herself. And so I knew very early on that this was going to be my path. Since then, I've really worked as a clinician in pediatrics and adolescent medicine. I went on to do clinical research looking at how health professionals address sexuality with patients and really pushing that frame beyond disease, disaster, and dysfunction. And in my current profession, I teach a variety of students, including medical students, public health students, postdoctoral health policy fellows, graduate students, masters in public health students, lots and lots of students and health professionals any way that I can to really get conversation and dialogue going about this aspect of our lives that is so essential from in utero through death.
And it's important, as you know, to teach health professionals because a lot of the time they don't have actually courses in sexuality, except for yours.
Yes, having those spaces, so whether it's at professional conferences, so I'm currently co-chairing the American Association of Sexuality Educators, Counselors, and Therapists annual conference, where it's another space of bringing a lot of people together to talk about sexual health issues. I'm also on the board of the Society for the Scientific Study of Sexuality, so another audience where we're working on getting messages out and doing really strong research to support many aspects of human sexuality. And in the medical arena, I'm on the American Association of Medical Colleges, lesbian, gay, bisexual, transgender, and individuals with disorders of sex development working group, because again, we're looking at ways to get messages out and talk about these essential aspects of our lives.
See what I said? She does a ton of stuff. There's something I was going to say. Oh, yes, you mentioned the disease, disaster, dysfunction model. Could you explain that a little, what that means?
Sure. So a lot of funding and attention has been focused on the anatomy and sexually transmitted disease or infections or unintended pregnancy, and not as much on healthy relationships. And I like to talk with my students about how you look at your sexuality as a blank slate, how you create those relationships that are safe, sane, consensual, and pleasurable. Because if we can look at models for healthy relationships, then we might not have to live in disease, disaster, and dysfunction because we have communication and we're making good choices.
So you could compare that to, in other medicine, the preventative care and health maintenance as opposed to fixing things when they go wrong.
Yes. When we're on the fixing end, we have a lot of other problems that we usually have to try and unpack, versus if we're on the preventative end of things where we're having those conversations up front, we're giving people the tools to make healthy choices and healthy decisions, then hopefully we won't see them on the back end.
Right. Excellent. Clearly I think that's a really good idea. And you also review for a lot of journals. Could you talk about some of the interesting studies you've seen come across your desk lately, interesting papers?
Sure. As a reviewer, I'm always looking for ways to keep my finger on the pulse of what's going on, and until things actually get in print, I can't say for sure.
Yes, of course.
But I can say that recent topic areas that I've reviewed have been looking at minority stress models and their role in sex therapy, and again looking at are there other factors that we need to take into consideration beyond just as the anatomy not functioning. I've looked at some global work that's been going on around sex education models that are used around the world, which has been exciting and interesting to see, particularly in Africa, and how kind of creative ways are being used where we know that there have been lots of problems with HIV and AIDS. And so for me, it's always exciting to see the new methods that are being used, how new populations are being reached, and the creative ways people are looking at going about that.
Very cool. There's something else that I wanted to ask, and I cannot remember right now. All right. I'm awesome interview. What would you say one of the more pressing issues in sexuality today is, or some, if you have more than one?
You know, I think the pressing issue is still the paradigm shift of moving out of disease, disaster, dysfunction. I think that finding ways to communicate with media to get the dialogue going, and that it's not pointing fingers to send somebody to somebody else for education, but getting that conversation going, whether that's in one's own household or family, or that sex education isn't just for adolescents, that we really have to take that step back and look at the lifespan approach.
Right.
And, you know, I think that we're still in a place where we need to be looking at that more. I think we're making headway, particularly in looking at research for lesbian, gay, bisexual, transgender, and individuals with disorders of sex development, because of the release of the IOM, the Institute of Medicine report, as well as the World Professional Association for Transgender Health's new standards. And I think that that's hopefully a wave that we're going to be able to see that will be helpful for sexuality on the whole, not just sexual orientations and gender identities. And so that to me is exciting to see, but I think it also paints the picture of how far we have to go in getting sexuality as a normal conversation, no different.
Yeah. Well, last question. Dr. Bayer has taught our biology, human reproductive anatomy biology class, and one of the things I really appreciated about what you've done is that you have a lot of different resources where we can go and look up and learn more. For the general public, what are some major accessible resources, so probably websites that you would recommend for more information?
Sure. I think some of the professional organizations in sexuality are always great places to start. So the American Association of Sexuality Educators, Counselors, and Therapists.
It's ASECT.
ASECT. AASECT.org. The Society for the Scientific Study of Sexuality, or SSSS. That's the acronym, sexscience.org.
Okay.
I think for information for lay populations or language that's easy to understand, the Centers for Disease Control and Prevention, or CDC.gov, particularly their National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention.
Wow.
It's a mouthful. But they have their information that's easy to access and understand.
Cool.
So I think looking at those credible sources, answer.com, or answer, I think it's answer.org or .com at Rutgers has got great information on adolescents. So kind of depending on the population that you're looking at where you want to go, those are really great credible resources.
Okay, better than Wikipedia.
Yes, much better than Wikipedia.
All right, well, Dr. Bayer, thank you very much for your time.
Thank you.